Good morning, everyone, and welcome to today's webinar, Variant Interpretation Challenges and Use Cases Leveraging Mastermind in the Clinical Lab. My name is Garrett Sheets, and today we're going to explore a variety of real-life clinical cases and workflows that will illustrate how the Mastermind Genomic Search Engine serves as a streamlined variant interpretation tool in the clinical lab. Our speakers today have a lot of great information to share, so I'll get right into housekeeping. So for those watching, feel free to put your questions into the Q&A, and if we have time, we'll get to those at the end of the presentation. This webinar is being recorded, and we will email you the recording within the next day or so. So let's get started. I will briefly introduce our speakers. We have Dr. Mark Keel, Genomenon's co-founder and chief science officer. Hi, Mark. And we also have Dr. Dan Bellissimo, director of the Clinical Genomics Laboratory at the University of Pittsburgh Medical Center. Mark and Dan, thank you both so much for joining us today. Dan, would you like to get us started?
Okay. Okay, so my goal today is to show you some examples of how we use Mastermind to help us with variant interpretation in the clinical lab. So first of all, I want to thank my genome analyst for helping me put together some of these examples for you. But first, I'm going to start with a little bit of introduction to our lab at UPMC. Our clinical genomics lab, though we offer testing in a number of different areas, certainly the thrust of our work right now is in next generation sequencing assays. So a few years ago, we started offering some hereditary cancer panels for a variety of different types of cancer. We have built out a clinical exome, which is about 4,700 genes, where we've kind of made this content so it's good at carving out disease-specific gene panels. And we just recently started offering whole exome sequencing, and we're using a common wet chemistry platform to perform all these tests. So after we get the sequencing data, it goes into our informatics pipeline where the data is aligned and there's variant calling. And then after that, I think we all know this is where the work really begins now, is in variant annotation, ACMG classification. And I think what's really different here, with the advent of next generation sequencing in the lab, is that, in the past, I think most laboratories tended to be experts in certain sets of genes. Like, for example, in a former life, I worked in a lab where we did platelet and bleeding disorders. And so I knew those genes very well, and I knew where to find that information, and I knew what literature sources to track to keep up on that information. But now the problem ahead of us is way bigger right now, because now when we're interpreting whole exomes, we're talking about lots and lots of genes, and many which we have no familiarity with at all. So we really need to tap into data sources in order to help us interpret these variants. And a lot of these databases I list below in Nomad, when we're looking for allele frequencies, and ClinVar to see if anyone's reported it, HDMD. We use predictive tools, UniProt. A lot of times we're looking for protein domain information. And the literature still is a very important source to find a lot of the information that we need. And a lot of times, because we're looking for very specific information, a lot of the literature search tools can be problematic. So these are some of the challenges we have in variant interpretation. We have a large number of variants that come up in exome analysis. We have to have algorithms for prioritizing these variants for evaluation. We have to document the information we find on these variants to help us in future cases. And it takes skilled analysts in order to do this analysis. In my laboratory, I have 3 PhD people working on this all the time. There's been some publications show that to analyze an exome can take quite a bit of time, somewhere between 6 and 8.5 hours. And certainly as the more we do this, we get better at it. But anything that can decrease the amount of time that we spend analyzing cases is helpful. Certainly cases we find are positive right away are most straightforward to report. But cases that look negative or something can take hours and hours to make sure that nothing's being missed. So variant interpretation is a major bottleneck in the workflow for exome analysis. So tools that help us there really have a big impact. So literature searching is a crucial element in this. We're looking for specific information relevant to the ACMG guidelines, and in our lab, Mastermind plays a key role in helping us do advanced literature searching. So here's just some of the evidence that, typically we're looking for. Certainly there's lots of ACMG criteria, but I find these are the things that really kind of push a variant, out of a variant of uncertain significance space into likely pathogenic or move it into likely benign. One is the variant frequency consistent with the frequency of the disorder? It's a really important question. It's simple to answer for single gene disorders. It can be answered for multi-gene disorders, but other really complex disorders, it can be a problem. And a lot of times there's problems in penetrance and expressivity also that create an issue with this question. Is the prevalence of the variant in affected individuals, significantly increased compared to control? So is there any case control data? What are the phenotypes reported with variants in the gene? Do they match the patient I'm looking at? Are they related? Does the variant co-segregate with disease in the family? Is the variant in a critical or well-known functional domain or a mutation hotspot? Are there well-established in vitro and in vivo functional assays to support a damaging effect of this gene product? And does the variant follow expected inheritance patterns? So a lot of the times this is the key information we're after when we go searching in the literature. So I'm going to use some examples just to show how we've used this in the laboratory. The first one is an example from our hereditary cancer panel. We had a patient come in with a history of breast ovarian cancer. They ordered the hereditary cancer panel. Assay was performed and a variant was detected in PELV2, and there you see the frame shifting variant there. So as we go into Mastermind, if you're not familiar with this, you can go into the search screen and just enter this variant PELV2, and you can start typing it, and you can see that it will appear below in the list, and you can select this to start your search. And what you get back then is a list of publications that are related to the terms that you have just put in. So in this top section, we pretty much get the publications, the publication dates, its relation to the journal impact factor, and its relevance to the term. So this is just kind of a pictorial picture of what references may be most suitable to you. Down below, what you get is that we can sort these references by different things. Here it's sorted by relevance. You also have the ability to export these references. We get information on the amount of times the gene is mentioned in the paper. In this case, it's mentioned 79 times, and we also get information of how many times the variant in specific is mentioned in this paper. That kind of helps us with the relevance of this paper. We get down below here, we see the PubMed ID link to this paper. We can also show the PDF. And then down below, we get a little bit of the context of this variant inside this paper. You can see some of the terms. You can see that this variant is specifically named. You can see it like it's in a Polish woman who's diagnosed with ovarian cancer, and other information here that's useful. And then down below, we even get some protein nomenclature, some RSID. So a lot of information comes up that helps us sort through these variants. So one of the big benefits, though, in going through this list is we have other ways of sorting these terms, and you can see this across the top of the bar. And one of the things we most commonly go to is trying to sort these references based on information we need for ACMG interpretation. So if we go into that tab, you can see all these different choices on the left and all the different criteria from ACMG in which we can refine this search. And in this case, we're going to be just giving an example of we're going to be going into the pedigrees and case control data, and we're going to be selecting, specifically looking for on the right side case control information. So we add this to our search, and then once again we see this reference that comes to the top, in which we see the variant is mentioned. And we can get all the information about the PubMed ID and some context down below. And we can jump into this paper directly and take a look at it. And we see that, from this paper, we can see right away that this mutation that we're talking about here appears to be like a founder mutation in the Polish population. We say it's part of a study here in which there was 107 patients and 1690 controls. So we have some idea whether there's some enrichment in this population. And then we also get information in the results about the frequency of this variant in this population. So a lot of information helping us catalog this variant in this case. So the next case is another case from our hereditary cancer panel, and I do like this example because it just makes us be concerned about how we interpret splicing variants. And so again, a person with a medical history of hereditary breast ovarian cancer, the panelists perform, and this time we detect a variant in BRCA1, and it's a splicing mutation in a consensus splice site. And our first jump is to say, oh, that's a for certain likely pathogenic variant because it's in a consensus splice site, and this one's expected to result in an out-of-frame transcript in the skipping of exon 10. Okay, so we can go into Mastermind and enter this variant. Once again, we can see that if we start typing the name, it appears below. We can select it. We can go in and see these papers, and I think one of the things you can see right away is, first of all, there's a lot of articles identified, but there's one article here where the gene and the variant are named a lot. So you kind of get an idea that this is going to be an important paper and exploring this variant. So we can immediately just jump to that paper, and you can see from the title that something more complicated is going on in this case, where it's combined genetic and splicing analysis of BRCA1, and here's our variant on a haplotype with another variant, and it highlights the relevance of naturally occurring in-frame transcripts for development of gene variant classification algorithms. So I don't expect you to read the whole abstract, so I'm just going to give you a little bit of summary here on what is in there. The overall message is that the odds for causality, considering the case control study they did, that this is extremely low, that this is a pathogenic variant. You can see the number there is extremely low. That this splicing variant 594-2A to C is always insists with this other variant, C641A to G, that the haplotype causes exon 10 skipping, mainly due to the variant that's the position 641, not the consensus splice site. Also in this study, they found when they looked at splicing transcripts that they show that 30% of the transcripts were actually a delta 910 transcript variant that's in frame, and it's also present in normal controls and sufficient for tumor expression. So this variant should not be considered a high-risk pathogenic allele. So just to give you a little bit of picture what that looks like, what they're saying is that in the normal case, this wild type, you can see that 66% of the transcripts were full length, but a considerable amount of it was this splice variant, delta 910. And then when we look at the mutation case where these two variants are present on a haplotype, you can see certainly half of the full length transcript goes away, but the amount of this delta 910 transcript never changes. And it turns out this transcript is important also in providing protection for tumor suppression. So, to me, this points out something I'm always concerned about when I look at splice variants is, first of all, do we understand what normal splice variants are? Because sometimes they're not all full length, and there's already missplicing that's occurring. And then the other question is how much missplicing is pathogenic? I see lots of data always in the literature where someone shows that something missplices because of a variant, but the real question is how much missplicing do you need before you lose the tumor suppression effect? And that's a difficult question to answer. But this was just a really good example of how something that looked like a likely pathogenic variant turned out to be benign, essentially. This is just some examples of how when we looked at the citations that we see in Mastermind for different variants as we were studying them, and you can just go through the list of these different variants, and these are pretty much in the cancer panel that we've done, and you can just see that the number of citations that are coming up in Mastermind is always higher than HDMD. I think part of this is just because it can immediately catch these as they come out in the literature. The last two examples in this table, PALB2, I'll be talking about these again a little bit later, but these ones are really important because these PALB variants are in ClinVar as variants of uncertain significance, but the new article that we were able to identify in Mastermind actually came out with a bunch of functional data on a lot of different PALB variants, PALB2 variants that allowed us to reclassify these as likely benign. So they were really important in determining how we classify these variants. So variant reclassification is also a big process that occurs in the labs nowadays. I mean, not only do we have to classify variants that we see in current cases, but we have to keep up with the stuff that we've already reported. So it's a real another workflow issue. So I'm really talking about updating classifications based on new information. And if your customers are like my customers, they're always asking us, what's your process for variant classification? How do I know your laboratory has an ongoing process to provide updated interpretations? Are you going to send me an updated report when the interpretation changes? So it's really important to have some kind of process to be able to do this without it being too onerous in the laboratory. Right now, we offer variant reclassification. We may perform this at the physician's request. A lot of times a patient may be coming back in for their yearly appointment, and the physician's trying to find out, has that changed since they were last here? We can get if new data is published. I just gave you an example of PALB2 where new data came out and a whole set of variants kind of got reclassified. And so that may lead to a reclassification event and reissuing of reports. We may reclassify a variant as part of a new case. So we haven't looked at a variant recently, but it comes in a new case and the analysts go through it again, find new information that leads to reclassification. But certainly the main tool we're using right now is automated literature searches are our main tool for finding new variant information to determine whether we need to reclassify variants. So I'm just going to show you how that looks like. In the Mastermind, this is called setting up a Mastermind Alert. And so we're able to set up alerts based on disease. We can list specific variants in these genes. We can determine who emails are going to go to about these alerts, and we can determine how frequently we want these alerts to be sent to us. A lot of it's just how much email you want to get. Variant information doesn't change that fast, but these are extremely useful in the laboratory to help us monitor the literature for publications that come out that may require us to reclassify variants. So we can set these up with any notification frequency we want and how we want to receive this information. And it really does allow us to assure our customers that the variants of uncertain significance and other likely pathogenic variants are being continually monitored for new information. So down below in that second half of this slide, I'm just showing you an example of what one of these alerts look like. And you can see there's a number of different variants being here tagged as no new variants, but you can see one here for the PALB2 that says one new article, and then the article is listed. And this was the functional characterization of 84 PALB2 variants of uncertain significance. And you can jump immediately to this article or view it in Mastermind. And so this was the paper that helped us reclassify those PALB2 variants that I just mentioned. So this can be extremely useful, and it's a way you get alerted when something is new versus someone constantly chasing around looking for new information. I mentioned the other way we get is when someone gives us a request for an update on a case, and this was just an example of that, where we had a reported BRCA2 variant that was a variant of uncertain significance. It was this proline 655 leucine, and so a genetic counselor calls the lab to ask whether there's additional information on this variant that could change the classification because the patient was coming into clinic. And right now there were two ClinVar the entries in ClinVar, including one from our lab. So if we go to ClinVar and we look up this variant, we see that there's two labs down below, and there's our laboratory, and we both have reported these as uncertain significance. So again, the analyst is able to go in to Mastermind and set up this gene alert looking for this this variant, and looking at the publications that come up. They see that there's a new genetics and medicine paper that has this gene listed in the article. They can see that it's actually found in this. They can see that it's found in the supplemental data for this article. And again, that's a really strong characteristic of Mastermind, that's able to find data in supplemental tables, which is not always possible. So they can go and pull up this paper, look up into the supplemental table. And it turns out in this case that there was no functional analysis performed, and the variant stayed as a VUS. But it was a way to quickly go into the literature for very specific information and determine whether there was anything new on this variant. So now I'm going to give you some examples from our Exome work. And so this is just a case of a 24-year-old, and you can see the phenotypes that we were given as part of the HBO terms. In this case, hypoplastic posterior communicating artery, mixed hearing impairment, joint hypermobility, hydrocephalus, delayed speech and language development. So, again, these HBO terms are used to help sort our variants and to find the ones that are most likely involved. And one of the variants that came up was a loss of function variant and FOXC1, which looked like it was a likely pathogenic variant. And FOXC1 is involved in a disorder called Axenfeld-Rieger syndrome. And it's a dominant condition, and if you look through the phenotypes here, you can see that a lot of these actually match up quite well with the patient phenotypes that I just gave you. So part of the work the genome analyst has to do at this point is say, okay, I have a loss of function variant. It's actually in the C-terminal part of the protein, so a lot of times it's concern about whether C-terminal loss of function variants are pathogenic or not. So he goes and tries to find more information on this variant. So I have the variant here listed at the top. You can see what it is, and he starts with just putting in FOXC1, and you can see you get back about 3,100 publications on this. But then again, once again, we can go into the ACMG criteria, and we can add this way to sort the literature, saying, I want information on loss of function variants. And then the final step is to say, okay, and I really want information on the C-terminal domain. So we have a text term C-terminal domain, C-terminal in this case. So now we're filtering by all these criteria, and then here's the output of that search. So one of the publications that comes up is a Journal of Biochemistry article. That's important because I don't think the JBC is a journal a lot of geneticists read, and certainly not back to 2002. And we get the PubMed links, and we get this title, and we can see the title is transcriptional regulation is mediated by N-terminal and C-terminal activation domains. And so this is a really relevant article to the information that we're searching for in this case. And it said that even though the data, this is obviously a well-studied gene because this data is going way back, but a lot of the functional analysis of domain structure happens on the biochemical side, and that's why that's appearing in the Journal of Biological Chemistry. So, here's the paper, and then in the abstract, and what you can learn from looking through this is that you find out that the C-terminal has some really important activation domains, and that this mutation would be predicted to disrupt them. So again, it was information we needed, one, to make sure a C-terminal loss of function variant would be pathogenic, and we could actually point to the specific functional domains that would be taken out and the probable effects of that in this case. So it was a really important finding. Here's just another example of a case. Again, an exome case, a 2-year-old. We have congenital posterior urethral valve, an abnormality of the urinary system. And so this is one of those cases that takes a lot of work because it goes through the analysis pipeline, and you really can't find anything. And so what I wanted to just illustrate to you is a way you can use. We wanted to determine a gene candidate list to make sure we're missing anything. So what are the most common genes that might be involved in this disorder? Is it possible there's an unusual variant there that's just not being picked up? So that was the goal of this investigation. So you can go and Mastermind, again, it doesn't just search variants. You can actually add phenotypes into this search. And so this is showing the example as we start to type this, that this term is available in the search criteria. And we can select that. And then we jump right into the associations page, which is a new functionality that Mastermind has. And so, again, this is another way of taking this term and all the associated articles involved, and then filtering it again based on different characteristics. And you can see across these tabs here that we can filter this based on genes and variants, diseases, phenotypes, therapies, or CNVs. So the way we proceeded with this was to pick the disease as a congenital abnormality. We first did that. And then secondly, after that, we can click into the genes tab in which we see the genes that are most likely in publications involved in this disorder. So at the top of this is this SAL1 gene. So we can select that and look at the references. And then in this case, we identify a really good article on this disorder. And you can see the title over here, Novel Insights into the Pathogenesis of Monogenic Congenital Anomalies of the Kidney and Urinary Tract. So a really nice review that covers the genetics of this. And again, just enabling us to identify possible gene targets and to make sure there was nothing to be found in these, in which nothing was. But again, a really quick way of digging into the literature for very specific information. So the last example I was going to give was related to searching for CNVs, because this is a functionality that got added in the last year in Mastermind, and I find this a really useful property. I do help sign out microarrays for our cytogenetics lab, and I think one of the things you find out right away is it's a lot harder searching the literature for CNVs, and unlike sequence variants, which have a lot of standardized names and nomenclature to help you find information, what you find out in CNVs that the coordinates reported can, first of all, vary on the genome version, whether you're in version 37 or 38, the coordinates change. The coordinates can be different based on the platform that's used, because each platform has probes in different positions. So the breakpoints will be mapped differently. So if you actually do a search looking at breakpoints, you may not find what you're looking for. You could search by chromosome band, but this encompasses a really large area, and so it'd be harder to find what you want. The gene content can be variable. It can be included or overlapping in the different CNVs. And a lot of times CNVs can be reported in a variety of disease states. As a matter of fact, a lot of the CNVs that we see in the population are known because they were found in a patient who had another CNV which was responsible for their disorder, and the CNV is assumed to be a population variant because there was another pathogenic variant already found in the patient. So it can be really a lot harder to work through whether a CNV is associated with a specific disease. And finally, in CNVs, a lot of them are associated with phenotype variability and reduced penetrance, and that makes it a lot harder to find information on them and to know whether they're pathogenic. So I'm just going to show you an example of a search that I came across in the laboratory. So this was a case that came in with, the reason for referral was developmental delay, and the microarray identified a 206 kb loss on chromosome 16 in the P arm, and there were 9 genes that were deleted. So one of the things I had to do is find out whether similar deletions have been reported before, if there were phenotypes that were associated with this deletion or not, whether it was present in the population. I needed to know, was anything known about its penetrance, expressivity? Is it usually de novo, or are there carrier parents? Those are the kinds of things, again, I'm looking for. So, you can go into Mastermind and you can enter this, and you can see the nomenclature you have to use here, where I put del because it's a deletion, chromosome 16. I put in the chromosome position, and because I'm using HG19 coordinates, I put that in the search term, and then Mastermind automatically converts those coordinates into version 38 coordinates to allow you to go ahead and do this search. So I'm able to do that, and you get a screen here where it has identified 75 overlapping CNVs in this case, and here the results are down below. And you can see you can sort these results based on the starting point and end point of the breakpoint. You can sort them by their size. You could look at overlapping, whether they're exact matches or they're contained, they're intersecting, or they're surrounding. You'll see this listed here. And then you also see the number of genes that are in these CNVs. And as I mentioned, the one CNV we had reported was like a 206 kilobase deletion. You can see there are a number of deletions in that size range here. They all have 9 genes, and if we click on this, we see these are the 9 genes, and they're the exact same 9 genes. So you can look around for ones that include the genes specifically that you're looking for. Okay, so you can pick one of these, and go into the reference. I just selected one of these, and there's a publication here, which is a publication that was in the Journal of Molecular Diagnosis. And from that, when you went into this paper, you could actually see they also reported this deletion there, and they reported the patient phenotypes and what they knew about the patient in this case. So we were able to use that information then to write this interpretation that this has been reported in association with a variable incompletely penetrant phenotype that may include developmental delay, obesity, behavioral problems, schizophrenia, craniofacial dysmorphisms, and these deletions can be inherited and de novo events. So all the information, either that article had it or also sent me on to other reviews about that same deletion that enabled us to collect this information on this specific CNV. I tried to use some examples here to show you how Mastermind, enables the genome analyst to quickly find and prioritize literature on the gene variants and CNVs. The search criteria are really flexible. They include ACMG criteria as well as pre-text terms. You can use phenotype terms. You can set up gene variant alerts to notify the lab of update information is available on variants. And this new genetic associations section, expands the criteria that we use to search for literature based on disease, phenotypes, genes, variants, and other therapies. So, overall, we found this to just be an extremely useful tool for literature searching. I wanted to thank my laboratory. This is the staff of my lab. I always say it takes a village, especially to do next generation sequencing work. There's lots of work done by everyone here on this page with the lab directors, our manager, our administrative head, the genetic counselors, my genome analysts, the IT informatics support team I have, and also the clinical lab staff. I really want to specifically mention the aid I got from Greg, Kevin, and Patrick on helping me assemble these examples for you. They are the main users of Mastermind, and they use it daily in their work, and it's been really helpful to them. So that is into my presentation. I thank you for your attention. Now I'm going to pass the presentation on to Mark, who can tell you a little bit more about Mastermind.
Hey, Dan, thank you so much. That was a fantastic set of examples exemplifying the value of Mastermind in clinical workflows. While Garrett gets my very short slide deck up, I'll describe what my role in this webinar is. It's to augment what Dan went through at a very detailed level, highlighting the value of Mastermind in clinical workflow, to provide an overview of Mastermind and how it's applicable in the examples that Dan highlighted, as well as in many others. So I'll begin by emphasizing that, as Dan alluded to, Mastermind, one of its main value propositions is the depth and breadth of its content. And one way to quantitate that is by demonstrating how many titles and abstracts comprise the data in Mastermind. It's the totality of the published literature, 30 million titles and abstracts. But obviously, as Dan went through in his examples, we go much deeper and index the full text of those prioritized references that have genetic or genomic or human disease related content. And we keep that up to date on a weekly basis. So to date, we have more than 8 million such articles that look for those components that Dan had described, the diseases, the genes, their variants, and a handful of other aspects that are useful for interpreting the meaningfulness of this content. The indexing of the full text articles includes figures and tables, which can be particularly challenging given the complexities of the data display and the way genetic variants are described in those references. But also, as was highlighted in the previous slides, Mastermind makes a great effort to get at the very useful supplemental content. And to date, though it updates weekly, we have nearly 3 million supplemental data sets. That's 3 million data sets, 3 million references with their associated supplemental data sets, which may be one Excel file, it may be 15. And when we index that content, we look for, no matter how they're described, the diseases and phenotypes, the genes with their synonyms and aliases and acronyms, and all manner of genetic variants, whether they're described at the cDNA level, at the protein level, or the RSID level, or as was highlighted, even copy number variants. And you can read more about this in a detailed study of how it's performed and the value and the comprehensiveness that it provides by following that link to our research paper. Garrett, if you turn to the next slide. In addition to the depth and breadth of our penetration into the medical literature, the way that we index is extremely exhaustive. And so the examples that were shown focused on cancer, but I'd like to pause here to underscore that we look across the whole spectrum of human disease, both hereditary cancer as well as somatic cancer, and in constitutional disease and all of their attendant complexities. So Mastermind is truly maximally sensitive, not just in terms of the content that is indexed, but in the way that we index that content. And we don't stop there. We put those data points together in what we refer to as genomic associations. And some of the fruits of that effort were highlighted previously, but with a little bit more detail. And say, draw your attention to the left there in the septogram, where it underscores which of those components we index for: the genes, the variants, including structural variants like copy number variants, the diseases, as well as the phenotypes in their ontologies, so daughter and parent pairings, including therapies, as well as categorized keywords to help variant scientists identify which papers are meaningful for identifying clinical cases and segregation with disease, as well as empirical functional studies, whether they be in vivo or in vitro. And when you put all that information together across all of the citing references and the depth to which the authors cite each of those variants and the related components in each individual paper, what you emerge with is an estimation of the strength of that evidence, which is highlighted there in a couple of different examples on the right, which is a way that we prioritize which references are most meaningful, and we draw your attention to that information in our prioritized list of references. So to sum up on this slide, there's a very healthy balance between the sensitivity that is demanded of clinical variant interpretation, but then also the specificity that is required to ease and streamline the workflows to minimize the burden on the folks in Dan's lab and others who have to go through this information. So Mastermind not only organizes this information and annotates it, but it's done so in a prioritized way where we show our work and demonstrate why that content was prioritized, allowing you to immediately verify and take action on that information. So next slide, Garrett. This should be, yes, this is a landing page for the Mastermind search interface, and it's really intended to be easy to use, where we allow you to perform any manner of search, whether it be a gene and a variant, which is a very typical use case in the settings that we had described, but you're also at liberty to add any one of a number of those other categorical terms or diseases or phenotypes or therapies, and do so in combination. You're also able to input free text search, which is a very powerful capability, but I would recommend that you invoke those ancillary search terms to enhance the specificity of your result as soon as you've got a lay of the land for the specific genetic variant or gene that you're searching for. So that's very faithful to the ethos of the Mastermind indexing and user experience, where we prioritize sensitivity and enable the user to modify their search to enhance the specificity. So sensitivity first and then specificity, but the feature set in Mastermind allows users to go about that very quickly in their workflow. I'll pause here also and underscore something that Dan brought up, which is to say this slide is meant to indicate that Mastermind in the user interface makes things easy for you. Dan brought up the alert capability, which is a way for you to stay abreast of newly published information about a variant for which insufficient evidence was presented upon first search simply because it hadn't been published before, or in other situations where the variant has no references and you'd like to be apprised of either new references or any references that have been published. The Mastermind Alert capability allows users to automate that process. But I wanted to emphasize as well, for labs that deal in high volume and have bioinformatic capabilities internal to their team, we also offer automation to those such users through API capabilities, as well as through various integrations with third-party software that any one of the users in the audience may already have at their in their workflow. So Garrett, on the next slide, already there was a fantastic depiction of the different feature sets in Mastermind. I just wanted to showcase how they all fit together here. And I'll summarize by saying on the right side, in the upper right portion, you see the literature landscape for your searched for terms, in this case, and in most cases, a genetic variant. You can see those prioritized references reflected by those enlarged circles, each one being a reference, where on the x-axis, it's the publication date, and on the y-axis, it's the quality of that journal. But again, the size of each of those icons is a reflection of the relevance of that content to your search terms that Dan highlighted in those numbers in the list of those references below off to the right. So that visualization of the literature landscape is depicted in list form. Just as on the left, the variant diagram for the searched for gene depicts all of the variants that Mastermind has indexed across the full breadth of the medical literature so that you can see your variant in context, which is useful for cancer and constitutional variant interpretation, particularly if there is no literature for your reference, or pardon me, for your variant. If there's no literature for your search for variant, there may very well be a different variant either in that same residue or in a neighboring residue or in the same domain, say, as your search for variant, which provides some measure of evidence for you to interpret the meaningfulness of that variant. And the variant landscape that's depicted visually by that Manhattan plot and in list form below, which is searchable and sortable, allows users to very quickly get to that information. Then at the bottom is the content summary, where we have the title and abstract that's highlighted with relevant terms. That's on the left. And then on the right is the context for the content comprising your search. So right now, by default, it's genes and variants. But if a user enhances the specificity of their search by adding phenotypes or drugs or diseases, you're able to toggle that sentence display to see those sentence fragments in context of the cited search term as well. So a very powerful shortcut to get at whether the content that you see displayed from the reference citations is relevant to your search. And then at the top portion is where users can modify their search by adding diseases, phenotypes, therapies, free text search terms, as well as in that highlighted blue dropdown in the middle there, any one of those canned categorized key terms such as clinical significance or functional significance, as well as a handful of additional search categories such as prognostic import or diagnostic relevance. So with that, Garrett, I think that's the last slide. I'll call Dan back to see if there's any questions from the audience that he and I can both field. But Garrett, if you advance to the next slide before Dan and I come to life here for the Q&A, Garrett, if you can advance, yes. I'll invite any audience members who have not yet experienced Mastermind to follow that link to gain exposure to the power that Mastermind can provide and how it can streamline and enhance your clinical workflow. And the the contact information is provided there below. And we love talking to users, so don't be shy if you ever want to talk to customer success or sales or support. We're happy to be at your service. So I'll turn on my camera. Garrett, you can leave this slide on so that people can jot down that link. I'll turn on my camera, invite Dan to do the same. Garrett, I'll have you field any questions that we got from the audience as Dan and I went through our content.
Sure, absolutely. First of all, that was a great presentation. Thank you so much to Mark and Dan for your time and your expertise. We did have a few questions come in from the audience. And for those listening, please know that if we do not get to your question, one of our team members will get back to you after the webinar. So let's see, one of our questions, what is the input file format for variant data in Mastermind?
Yeah, Dan, we'll just decide who takes the ball. That seems like it's pretty obvious for me, but I'd like to hear if you have any cleanup or any enhancement to my answer. We have the user interface allows you to search flexibly for any variant, but we also enable the Boolean or multi-parametric capability to search on multiple variants at once, though I would recommend in your workflow that be relegated to compound heterozygous cases. Whether they're in the same gene or in a different gene, if you've got a case with multiple variants, that's how I would recommend executing your search in the user interface. Though I'll say that your alert setup can comprise multiple variants. Obviously, the API lends itself to routine automation up to and including an entire VCF. There's batch upload to the API capability that allows users to upload an entire patient's VCF file. So Dan, I wonder if you could just touch on again how your lab uses Mastermind based on file format.
Yeah, I would say I don't have too much. I mean, we do it pretty simply. It just made me think that one of the examples you just brought up about using, multiple variants in a search and only when you're looking for combo heterozygotes. I think the other place you might see that occur is we get a lot of multinucleotide variants where actually depending on your pipeline.
That's a good point.
Yeah, there's two variants close together in a row, and I think there's some pipelines that actually split them out, and even though you can see they're together on a read, and so you need ways to put them back together or separately or whatever. But that may be the other place you use something like that.
Yeah, great point. Those are tricky. Those were great teaching points when I was going through my training.
Yeah. Because like I said, some pipelines split them, and I think even sometimes in Nomad they're split, even though the read tells you they're together. So.
Yeah, biology is complicated. It doesn't make it easy for us.
Yeah.
Awesome. So another question we had, and I know we touched on this a little bit, we continue to develop and improve Mastermind. For example, new CNV visualizations. Mark, I'm not sure if you can speak to that a little bit more, or maybe, Dave as well, or Dan as well, excuse me.
That's okay. We have a Dave internal to the team that Garrett talks about. That's a great opportunity for me to indicate that we're coming out with updates and improvements to the Mastermind interface, new features, new visualizations all the time. And it's in large part to respond to insight and feedback that we get from our customers. We've just fairly recently launched the CNV, so I'm happy to see in Dan's examples how they're finding value there. We're seeking to deepen that value that we provide by enhancing the visualization. So we lovingly refer to standard visualizations of CNVs as stacked pancakes, where you see the breadth of the CNV and how they stack up and relate to each other. And so a very talented developer on our team has come up with what I think is a fantastic visualization there that allows you to very quickly toggle through the CNV data set that comprises a search result in Mastermind to further enhance the value that we're providing. Getting you to that lower right where the sentence fragments are shown, which is the real challenging part, is indexing and finding and verifying those. The visualization in the upper left and the sentence fragment verification in the lower right, we feel like is going to even redouble the value that we're already providing in the CNV search.
Yeah, because for CNVs, a lot of times you're usually looking at that view you see in the genome browser where you see all the, the different CNVs lined up on top of each other against the gene map. So that's an incredibly useful view. I would say the only other issue you could have is like when you go through the conversion in the 38 coordinates, there's some areas where they don't match up well and the conversion may not work. And there you might just have to, go in by chromosome band or take a more gene-based approach or something to help you get to those CNVs you're looking at. And then once you're in there, you'll see the CNVs of different, sizes and things and gene content. You can whittle it down. So there are other ways to get around it if you need to right now.
Great, thank you. Let's see, is there an option for batch search or batch query without VCF?
I'll just say that it's to the user's tolerance. And that's why I would suggest that you keep it restricted to a case, because there's at least some interrelatedness to the variants within a case that you would want to search for. So let's just take an example, because Dan brought up some exome examples. There's obviously filtering that happens before you, as a variant interpreter, have a set of variants that you need to look at. And so that, depending on if it's a panel, it will be smaller, or if it's an exome, and the degree to which you filter, that can be a couple variants, it can be a dozen, a couple dozen, or hundreds. If you don't want to use a file and you don't want to use automation, you're going to be relegated to the user interface. If you want, as a user, to pattern those searches, then if you have a dozen or so, I would imagine that beyond a dozen, you'd be thinking about ways to automate. Although it's perhaps a simpler workflow to search on those variants one at a time and adjudicate the meaningfulness of that information, particularly to uncover what Dan alluded to in a couple of slides. And I love this because it's so tempting to focus on the affirmative and, oh, aha, I found this one reference and it unlocked the case and it went from a VUS to likely pathogenic or what have you. But Dan, you did a great job of highlighting the power of a null result. And coupling that with the sensitivity of Mastermind gives you confidence that if Mastermind didn't find it, there's no value to executing an additional search. And so, Garrett, in answer to that question, what I would say is when you have a case and you want to search for multiple variants, ticking off which of the variants in the exome result are null is valuable. And so I wouldn't want to spoil that value by bucketing all the variants together and just sort of, rolling the dice and seeing what comes out at the top. I think that users would benefit from taking a more methodical approach, and you could do so very quickly. It's 10-second search, 10-second search, 10-second search, and adjudicate the evidence, etc.
Very good.
I would say most of the time we get to that stage in our lab, the variant list has been paired, and now it's like the in-depth information on a smaller set of variants, exactly. Less than 10 usually. That's where we really employ this, and so it is on a case by case. Each individual is doing it as they work this case. Yeah.
Exactly.
Great. Let's see. Oh, here's a good one. Is there a limit on how many variants you can search at one time?
There is not in the professional edition, which is what was showcased in the examples and in my screenshots. The professional version of Mastermind is intended for clinical purposes where you don't want to be hamstrung by limits. We make Mastermind available to researchers and academicians in the basic edition where there are limits on search, but they refresh every week because we really want to get use. But in a clinical setting, we and our users feel strongly that you don't want to restrict the applicability of Mastermind. You don't want to relegate your searches only if this is true and this is true, then do you search in Mastermind, because as was highlighted in these examples, you don't know unless you search. And so one of the many feature benefits of the professional edition is this unlimited search capability. It's across any gene. It's unlimited searches during the week and into the perpetuity of your license, but also all of the features that we talked about, the category keywords, association page, et cetera, So that's where there's a distinct difference between the academic basic version and the professional or clinical version.
Cool. So how do you track the articles that have already been reviewed for a particular variant?
Well, I'll say we don't make that available in Mastermind. So Dan, I'll send that over to you and have you say whether that's a challenge for you, especially if you've got a very focused post filter variant set. How you get around that if there is that need in your use of Mastermind.
Well, I'd say that that's not an issue that comes up too much. I would say when we're doing our variant annotation, if there were certain articles looked at that were important in classifying a variant, they would be notated inside the file for this variant. So usually, especially if they're going back and doing a reclassification or something, they're well aware of the date that last was done and what the date of that last article was. So they wouldn't be so worried about whether they had reviewed it before. They're really looking for something new. Is there something after that? Because I already see that reference that I have. So I'd say most of the time that hasn't been a concern about list, because they usually the PubMed ID would get recorded for anything used, and so we have that information there.
Yeah, just a small plug again for the APIs. We have this great since parameter, so that as Dan suggested, you don't need to look at, or if your workflow merits it, you don't need to look at something that's 5, 10, 15 years old. The since parameter allows you to focus your results on just the content that's been published since a certain date. And then also, just as I said, search for sensitivity first and then use the features for specificity. If one of your aspects of specificity would be the date of publication, you're allowed to change the prioritization according to that date so that you can see just the most recent content. And as I emphasized, it's the content is up to date every week. So the alerts will keep you apprised of that in the background. You don't even need to think about it, but real time in the user interface when you're doing your search, if you just want to cut to the chase and see any new information, there's a very easy way to prioritize by publication date.
Yeah, I think one of the most, unfortunately, a lot of variants you look at, there really isn't a lot of literature on. So it's, I showed some examples of things that had quite a bit of information on them, but you will hit variants where you'll get nothing. And that's important to know too, because the next time you go and do it, if there's something, it's something new. But it really does make you stop not having to go digging deep. If nothing comes up at all, you kind of know there's not anything there. You're kind of stuck.
Yeah, I changed my philosophy now. It's human nature to be disappointed when you get a null result, but I've changed the way I think about it. I say, yes, I got a null result, and it just make it affirmative, right? Make it a positive, because it is, as you highlighted.
Yeah.
Very nice. I like that. We've got about 2 minutes left, so I wasn't sure if either Mark or Dan, if you had any closing thoughts before we end our webinar.
I'll say, Dan, that was really great. I hadn't seen your slides before. We've talked before at conferences and through support and with your people, but I have to say that was a really expert presentation. So thank you so much.
Thank you. Well, your team looked at my slides and they told me it was okay. So.
Good.
I'm glad you enjoyed it too. So, no, I enjoyed putting together. Like I said, my analysts would, I just kind of pretty much told them, I said, keep the, eye out for good examples of when it was really helpful. And so those are the ones they sent me where they really just stuck out, where it was really, really useful to get at something that, you can do Google searches and everything. And a lot of times, you find the main things and you find a paper, but you can't dig deep into specific content that way. And when you're looking for something specific, it just is really helpful.
Yeah, well, kudos all around.
Yeah, thanks.
Yes, that was a really, really great presentation. So I guess we'll close this out. Thank you everyone for tuning in. Again, this webinar is being recorded and we'll send you that very soon. Mark and Dan, thank you so much for taking the time to offer your expertise. If you have any questions, please feel free to send us an email at hello@genomenon.com. And if you haven't signed up for Mastermind yet, we do have a bit.ly link on the slide that we showed earlier where you can create your free account. and start with a trial of Mastermind Professional Edition. And we'll send you all of this information in the email after we wrap up. Also, at the conclusion of this webinar, you'll receive a short post-event questionnaire. Please let us know your thoughts about today's discussion. So with that, thank you so much, everyone. I think we had a really great conversation.
Yeah, thanks.
See you all.
Alrighty.